Alright guys, let's get busy talking about inflammatory pathologies of the male reproductive tract. We're going to be talking about the epididymis, we're going to be talking about the testes, and we're going to be talking about the prostate. What I really want you guys to focus on is what I'm kind of outlining here in red here, and it's going to be the age differential as well as the infectious organism differential that is going to be important on test day. And it's important that we realize that different bugs are going to infect different age groups when it comes to these inflammatory pathologies of the male reproductive tract. So let's go ahead and get started by talking about epididymitis. And epididymitis is going to be inflammation of the epididymis, and that's this green structure that I'm highlighting here over in our diagram. And it's important to note that this is most often going to be caused by some type of bacterial infection. So we have inflammation of the epididymis, usually secondary to infection, and this can progress to involve the entire testicle. Now, the important stuff here is the differentiation between younger and older males. So let's go ahead and get into it. Young sexually active males are more likely to be infected by chlamydia or by gonorrhea, as opposed to our older males who are going to be infected by either E. coli or Pseudomonas, and also these patients tend to present with UTI type symptoms. Additionally, our older males with UTIs or E. coli and Pseudomonal infections are more likely to have bilateral infections as opposed to our younger males who are more likely to have unilateral infections. So that's going to be an important differentiating factor for you guys to pay attention to. And then we also have Beckett's disease, which is going to be autoimmune granuloma formation in the seminiferous tubules. And Beckett's disease is going to be a process that infects both the testicles and the epididymis. So if we were to look where Beckett's disease has its disease process, it's going to be in this interface right between the seminiferous tubules and the epididymis. This is where the granulomatous inflammation is going to occur. And remember, granulomatous inflammation is often going to be this spherical inflammation pattern. It's going to be characterized by giant cells and epithelioid macrophages. Those are going to be hot words to look for on exam day. So be sure to be on the lookout for that language when talking about epididymitis. And in terms of a presentation of all epididymitis, it's going to be posterior testicular pain with positive Prensign plus or minus dysuria. So let's orient ourselves to anterior and posterior. The epididymis lies on the posterior side of the testicle, whereas over here will be the anterior side. And then let's talk about what positive Prensign is. So I'm going to draw an imaginary finger down here underneath our testicle. And what Prensign is on physical exam, if you were to lift the testicle up with one finger, that should relieve some of the pain associated with the epididymitis. This is as opposed to a negative Prensign, where if you were to lift the testicle, you would still have pain. And this is important for differentials because testicular torsion, which is also going to present with testicular pain, will have negative Prensign. So lifting that testicle in a patient with testicular torsion will not relieve pain, whereas a patient with epididymitis, if you lift the testicle, it should relieve their pain, and that's a key differentiating factor on test day. So let's move on now to talk about orchitis. And orchitis is going to be inflammation of the testicle itself as opposed to the epididymis. So if we talk about the pathophysiology here, it's going to be very similar. It's going to be inflammation of the testicle, usually secondary to infection. And the rule that I want you guys to pay attention to is the population and the bugs that are affecting this. So in our young sexually active males, it's going to be chlamydia and gonorrhea. And then in our older males, it's going to be E. coli and Pseudomonas that can be accompanied by UTI-like symptoms. Now, there's an additional factor here that is important, and a vignette you may see on test day is going to be like a 5 or 6 year old male who's completely unvaccinated, who's presenting with some facial swelling as well as painful testicles. And this should be raising your alarm bells for mumps orchitis. And mumps orchitis is a specific type of orchitis that is due to the mumps virus, and it's going to lead to increased risk of infertility. And so this is something to have on your differential if you have an unvaccinated young child with testicular pain. Additionally, we talked about Beckett's disease and how this disease process is autoimmune. This is going to be in the interface between the testes and the epididymis, so this can cause both epididymitis and orchitis. It's the autoimmune granuloma formation in seminiferous tubules. So in terms of our presentation of orchitis, it's going to be testicular pain and swelling plus or minus dysuria. And it's important to note that orchitis is going to be really uncommon in our patients under 10 years of age, with the exception here of maybe mumps orchitis. You might expect at a younger age because mumps tends to affect younger kids. But as far as the non-mumps orchitis, we're expecting this in our teenagers and above as far as population. Let's move on to talk about our last pathology of the day, which is going going to be prostatitis, and prostatitis is going to be inflammation of the prostate. And so we're expecting the same pattern of pathophysiology here. It's going to be bacterial infection leading to inflammation, this time of the prostate. And then our general rule is going to apply here as well. In younger males, we expect chlamydia and gonorrhea infections as our main sources. And then in our older males, we're going to be expecting E. coli. And now I want to make a plug specifically about chronic prostatitis, which is something that can happen after an event of acute prostatitis. So acute prostatitis is going to be bacterial, and what's going to happen is we can get nerve damage or irritation from a previous infection of the prostate. And it's important to know that the sacral plexus is a network of nerves that runs alongside the prostate and throughout the pelvic region. And when the prostate is aggravated, it can irritate these nerves, leading to prolonged symptoms. So it can cause pain with urination, or perhaps difficulty with defecation or back pain. The constellation of symptoms from this nerve plexus can be quite broad, and this is characteristic of chronic prostatitis as a result of a previous infection. So that's something to be on the lookout for when we're talking about bacterial or non-bacterial chronic prostatitis. And in terms of presentation, we can expect dysuria, frequency, and lower back pain. And then on physical exam, we were to do digital rectal exam, we would see a swollen, warm, and tender prostate. And this is important in terms of differentials because there are some other diagnoses we can achieve via digital rectal exam, and that's going to largely be prostate cancer as well as benign prostate hyperplasia. And in prostate cancer with digital rectal exam, we would expect to see a lumpy and nodular prostate, whereas in prostatitis, we expect this to be a smooth, enlarged, warm prostate that is tender. Whereas in benign prostate hyperplasia, we don't expect a nodular prostate. We expect a uniformly enlarged prostate, but it shouldn't be warm or tender. It should be a relatively benign exam in terms of the digital rectal exam. So that's a good way for you to differentiate your different prostatic pathologies based on your digital rectal exam, because these are all pathologies that can occur in the older male age group, and it's important to be able to differentiate these using your digital rectal exam in test questions. So remember, the key to acing these questions on exam day is going to be remembering the differential of the organisms by age in our younger and older males, and then being able to recognize the important physical exam findings like Pren's sign and an accurate digital rectal exam. With this, you guys should ace these questions on test day. Can't wait to see you guys in the next video. Bye!